Good afternoon, everyone. Thank you for the opportunity. My name is Suandika. I'm from the Department of Anesthesiology, Faculty of Health Science, Harapan Bangsa University in Purwokerto. In this time, I would like to present my study with the title Comprehensive Nursing Intervention in Chronic Heart Failure, a narrative review of clinical, educational, and also ethical dimension. For our authors from another university in Cilacap and Purwokerto, and also in Pekalongan University, such as Mr. Sodikin Isrova, Dr. Ramayanova Yuniar Melissa, and Mr. Ayudhya. I move to introduction. Heart failure is a complex, progressive, and has a syndrome and a major public health issue that continues to grow in prevalence and complexity despite significant advances in medical and technological treatment. In this study, we have a global burden of cardiovascular disease and risk. For the example, we have a 60.4 million people in the world have the cognitive heart failure effect. That is bad condition such as high rate of readmission and disability and also mortality in the worldwide every year. Burden driven by aging population and rising cardiovascular disease and risk in the human being. For the nurses play to key role beyond medication such as behavior, educational, and ethical support. We need to consider about those part of the care. I would I would like to move to objective of this study. We have a synthesis current evidence on comprehensive cognitive heart failure nursing intervention, such as we look at the clinical part and also in the educational part and ethical part. As we know about the comprehensive heart failure understanding, we need to critical thinking about the medical history and physical examination for consider for good examination in the first gate of the uh, care in the patient of CF. Regarding of the gathering of diagnostic parameters, we also need to look at the laboratory data result of the human body. And also we mentioned that drug-induced assessment also important. Establish biomarker measurement, we need to have some laboratory data and another examination such as radiologic and echocardiogram. All of these things of the comprehensive heart failure for understanding all of the uh, clinical practitioner in the hospital. About the research method, narrative literature review in this study, we sources 50 English language textbook from the 2011 until 2021, including criteria such as nursing focused by cognitive heart failure, cognitive heart failure specific, and integrating ethical and also clinical education domain in the practicing and the educational. And the data extraction and thematic synthesis. This theme was synthesized into 7 core domain and organized using the nursing process model encompassing assessment, diagnosis, also planning and implementation and evaluation state of the all of the mind. I mentioned that we have 7 domains. Domain identified by such as vital signs, lifestyle modification, dietary regulation, and another one is patient education and counseling. Also consider about the diagnostic coordination and must be have focusing about the drug and oxygen therapy. All of this, finally, we need to look at the ethical and holistic nursing practice in the care of in this CHF patient. I will move to result of the study. We can look at the table number 1, thematic domain of nursing care in chronic heart failure patient. I mentioned that in the left side, I mentioned that we have a seven domain of the nursing care in chronic heart failure, and another one have core nursing intervention and clinical focus. I will start in the first one, such as vital sign and monitoring. Core nursing intervention, we mentioned that a routine assessment of blood pressure. We also look at the heart rate, respiration, oxygen saturation, and weight. Why weight is very important of this? Because a lot of the chronic heart failure has about the regarding of weight. Another one is the clinical focus. In the vital sign monitoring, we need to early detection of fluid retention and hypoxia of human body. A lot of the chronic heart failure have retention of fluid and become hypervolemia of the human body. In the second one, we look at the lifestyle modification, such as smoking cessation, and stress reduction. Also supervised exercise. Supervised exercise. For the clinical focus in this state part, we look at long-term symptom control and cardiovascular health. In the third one, the dietary management, such as we need to look at sodium or fluid restriction, fat reduction, and also portion control, and cultural tolerant nutrition plan. In the clinical focus of this part, we need to prevent the compensation and manage volume overload of the human body. Drug and oxygen therapy, we need to look at medication administration, monitoring for side effect of drug, oxygen titration. We need to look at the oxygen needed in the patient, optimize pharmacologic therapy, and relieve hypoxia. In the diagnostic coordination, we need to collaborate with another part of multidisciplinary in the facility of hospital, such as facilities of electrocardiogram result, echocardiogram examination, and laboratory data tests for clinical focus, support diagnosis, and track disease progression. Okay, I will move to patient education and counseling. This is also important in this theme because for core nursing intervention, medication literacy, and symptom recognition, we need to behavior coaching by psycholog and counselor. For clinical focus, we need to promote self-care and reduce readmission. In the last one, I have this in the seventh theme of this study, we mentioned that ethical and holistic nursing practice. We have core nursing interventions such as a respect for autonomy, informed consent. We need to prepare it and make sure that have in the every single of the intervention we did for the patient. Cultural sensitivity, we need consider about this because everything or a lot of people have unique cultural sensitivity. And another one for this part, we need clinical focus such as alignment care with patient, value and right of this ethical and holistic nursing practice. Okay, ladies and gentlemen, I will move to discussion part. I will show you guys about the vital sign monitoring. We mentioned that nursing lead telemonitoring reduces readmission and mortality. This is very important for our nursing care to the predictive value of this parameter in signaling acute decompensation is well supported by contemporary evidence, reinforcing nurses' central role of proactive symptom surveillance and decision-making support. That's a study by Bruland 2030 and Severn et al. 2022. When integrated into telemonitoring system of nursing-led outpatient follow-up program, vital sign monitoring has been shown to reduce unplanned hospital readmission and mortality rate. Ladies and gentlemen, for lifestyle medication, yeah, we need to motivational counseling improve adherence. When nurses incorporate behavior change theory into routine care, such as motivational interviewing and state of change counseling patient, demonstrate significantly better adherence to lifestyle goal. Yes, this is very important to lifestyle modification. For another one in the dietary management, nurses patient need to collaborate with the cultural adaptation plan. A randomized study of Sonsa et al. That demonstrate that nurses-guided dietary counseling significantly improve fluid management and reduce emergency visit among chronic heart failure patients in Brazil. That's a good study. We can adopt about the result of study. And drug and oxygen therapy, I was mentioned that nurse-led medication, yeah, improve medication literacy and clinical stability. Given the complexity of the chronic heart failure regimen, including ACE inhibitor, beta blocker, and diuretics, nurses must monitor for side effects such as hypotension because we give the diuretic and also beta blocker medication. And another one, such as hypotension, also we mentioned that we consider about the electrolyte imbalance, adequate patient on medication use, and titrate oxygen support as needed. Coordination of diagnostic testing. Nurses play a pivotal role in ensuring timely, accurate diagnostic and testing. Nurses ensure that echocardiogram, laboratory data tests, such as INT, BNP, and also echocardiogram are performed. The result communicated effectively, especially to transitional care setting to more crucial in managing elderly patient of those cognitive limitations, where care community often depend on the nurses' advocacy and communication. Patient education and counseling, uh, I have read by study with Tian et al. That confirm the efficacy of nursing-led education in change in chronic heart failure outcome, especially when educational reinforcement through telephone follow-up or home visit. We need to visit of the home patient. When education is personalized and adapted patient cognitive and literacy level, we have considered that and more give the good quality of life of the patient. And another one in the critical and holistic care, palliative care discussion, yeah, advanced directive and shared decision making become ethical complex. Nurses are often the bride between, yeah, bride between patient families and physician their sensitive conservation. The inclusion of palliative care principle in chronic heart failure, nursing practice, and as emphasis in Vidio et al. Has been shown to improve quality of life patient stratification and alignment of care with values. That's a good thing also. Okay, everyone, I will move to conclusion. This narrative review synthesizes current evidence into a seven-domain care, domain nursing care framework for chronic heart failure, encompassing vital sign monitoring, lifestyle modification, dietary regulation, pharmacology, and oxygen therapy are important, and also diagnostic coordination, patient education, and holistic ethical consideration are holistic care also needed. This domain reflects the multifaceted and essential role of nursing in optimizing patient outcome, enhancing self-management and supporting continuity of the care across setting by aligning with the structured nursing process. This model offers a practical and evidence-based guidance for nursing practice, educational, and policy. That is complex, yeah, complex condition. We need to comprehensive care of the patient. I hope in the future results will be focused validating this framework and this first clinical environment to ensure its adaptability and impact on reducing heart failure relative morbidity and readmission rate of the study. Yeah, I hope that. Okay, this is my references, and this is my last one of my slide in this presentation. Everyone in the International Nursing and Health Science in Universitas Muhammadiyah Purwokerto, I have thinking and regarding this study. I have this, let us use the seven domain framework, not only as a guidance in our clinical duties, but as a foundation for empathy, resilience, and leadership in heart failure care for become improved quality of life of the chronic heart failure. Thank you very much for the attention. And if you have any question, I can to write for you. Thank you very much. Bye-bye.